People have started using this Ozempic for fast weight loss, but it will cause
acute hair loss in more than 300 individuals. The wheat that they were consuming from Punjab and Haryana had very high levels of selenium.
Men who smoke are 2.5 times more likely to lose more of their hair before 30.
people have switched over to vaping, considering it as a safer option, but it will.
Hair that is lost, is it possible to get it back?
There is nothing like hair loss. It is hair thinning. We can surely control it, but once it is, we cannot reverse that back.
Caffeine. Some say it increases blood circulation, therefore it's good. Others say not really. What about caffeine? 40% of people are not even able to identify what their hair type is.
It's very simple. There are the
Hair wash. Is there a right way to do it? There's a saying that don't use hot water. Does temperature play a factor?
yes, using.
Some people say oil overnight, some people say oil 20 minutes before, others say don't oil.
It's majorly misunderstood that it's going to treat your hair loss.
Have there been any stories of natural remedies that have gone wrong?
A lot.
I think one of the patients was using a combination of garlic paste. They checked in the reels and they ended up using that. Got severe burns, 2 weeks to treat this condition.
Let's talk about the whole process of hair transplant. What is the cost component?
From like 1.5 lakh, and it also goes up.
US, London, Dubai, Singapore. People are charging. Entire cost part is become a commercialization and marketing gimmick.
What's the difference between hair fall and hair thinning, and how should they be treated differently? How do you treat a receding hairline or a balding crown? What are the most effective treatments for dandruff? For those who color their hair, what should be the best practice? Onion juice and amla for hair growth.
It's a hype.
Punjab, there was a hair camp that was happening, and they had provided some hair oils to them. 60 to 70 people who are hospitalized with eye symptoms.
3 non-negotiables that people can do on an everyday basis to maintain the quality of their hair. Welcome to Humans of Bombay, Abhishek and Priyanka. So lovely to have you here and to discuss my favorite topic in the world, which is hair.
Thank you so much for inviting us.
Thank you for inviting us and helping us be here.
And I love everything to do with hair care, and I'm always the one, looking up little, what can I do differently in my diet, and there's something new that's always cropping up. So I'm the most excited, and I've had a lot of my personal questions answered in this. So looking forward. We'll start with something that's a trend right now, right? There are these viral hacks that you see on your reels or viral hacks on YouTube where some people claim that you can grow X amount of hair in 3 weeks, etc. There's all kinds of things, right? And you don't really know which way to grow because everything looks so credible, the way it's short, the way you look at it. What is the one thing about hair that you guys would like to talk about that people just don't understand till now?
Yeah.
So basically, I'll say instead of going with the viral trend, you should have a scientific backing for that. Understand every hair is individually different. It is different for every individual. You shouldn't be just following the trends and just following it blindly. It may end up damaging more. So hair itself, hair follicle, they are many organs. So they get affected with a lot of hormones, lot of stress, nutrition, medication, everything may affect, and none of the viral trends will actually treat your hair loss or thinning or male or female pattern baldness. So I would always suggest that it should be backed by a science, by a consult a doctor, a dermatologist first before doing anything.
Absolutely. What about you?
That's true. I think the way things are trending, especially you see those miracle shampoos and those, sometimes you see those 30-day challenges of the money
serums,
back and all of that. I think people tend to have this misconception that, you can fix your hair problems like overnight. Whereas hair issue is a lot to do with how you are from within, like he rightly said, your overall health and your lifestyle and how have been your good habits over the years, and not like a quick fix that you are trying a trending oil and it's going to fix the problem. It's more internal, and the root cause has to be identified, and I think that's where such qualified dermats and doctors are required, where they can take a right diagnosis and then give you a structured personalized treatment plan based on your condition.
So one of the most common, I wouldn't say myths, but a understanding overall is that men tend to lose hair faster than women. So is it true?
So I'll say, I'll not say कि men tend to lose hair more, but yeah, if you ask me from a scientific medical point of view, visibly men do bald more. There's a lot of thinning which is seen in men, and a lot of baldness which affects men for sure because of the majorly dihydrotestosterone that's known as androgenetic alopecia. Most of the people face that, but at the same time, women are not spared from that. It is we see a lot of working professionals because of the hormonal imbalances, because of crash diets, because of stressful life. They've started facing the similar problem, diffuse thinning, overall scalp getting visible, and it is quite emotionally impactful for them too. And so yeah, we've started seeing a lot of female pattern hair loss also. And currently, I'll not say only men are affected, yeah, but women also.
Okay, so let's go into the different factors and how one can perhaps prevent it and cure it, if at all, right? So you mentioned a couple of internal factors. One of the things is diet, what we consume, and a lot of people say your hair is dependent upon the kind of nutrition or the food that it gets. Is that true?
Yes, it is. It is what you are, what you eat. Basically, that's what we say. It is reflected on your skin. It's reflected on your hair. So hair, basically, also, if I have to say, hair is made of a protein called keratin. So protein deficiencies will surely make your hair brittle, dry, and rough. Then there is in Indian women, if you have to say, they'll face a lot of iron deficiency anemias. Even a slight shift in the ferritin levels will cause a lot of shedding. Then there are a lot of microvitamins, vitamins B12, D, biotin, omega-3s, all these are helping in the hair growth and the cycle. So if there is a deficiency, for sure it affects your hair cycle and everything. At the same time, people go with these viral trends to have biotin gummies or some other multivitamins or something like that. But my point is, if you are not deficient, it's not going to make sense to take it. Better is get yourself evaluated once, annual checkup, blood checkup would see if there's any deficiency, just try to correct it. Also, if you're seeing nutrition wise depletion, if I have to say, very common topic, people have started using this Ozempic or Mounjaro for GLP-1 agonist for fast weight loss regime what they follow without understanding the downside of it. So when you are going on it may help you in reducing your weight very fast, but it will cause a lot of nutritional depletion. And that causes an accelerated phase of telogen, which I'll describe that later, but it will cause a lot of, it gives you a shock to the hair and causes a lot of hair fall. So we need to, if you're planning to take, I would advise go to a medical professional, understand the importance of the medicine what you're taking, how you have to annually keep a track on the blood parameters, nutritional deficiencies, and then go for it.
Yeah, because we are talking about nutrition affecting hair. If you remember, you must have read a very recent news. In fact, it made national news. This was an incident in Buldhana in Maharashtra. Very sudden onset of major hair loss and hair thinning was observed and almost documented for 300 individuals across, I think, 18 villages there. And the local medical people could not identify what exactly, was going wrong. Then a very detailed investigation was done, and they were very surprised to know that the wheat that they were consuming, the chapatis that they were eating, I think from Punjab and Haryana, that was imported, and that had very high levels of selenium. Now, selenium is basically a mineral, but when taken in excess, it has its toxicity. So the selenium toxicity actually caused like an alopecia totalis and such a massive acute hair loss in more than 300 individuals. And nobody could even guess that such a basic thing which is in your daily dietary life could, cause. So I think food and what you take obviously impacts the hair. So a lot of people misunderstand hair is all to do with the external care that you take, but it's a lot with what you eat.
Yeah. So are there any such superfoods, right? Like where that if you take this, it can only be good for your hair. There's no downside to it.
No. So I'll say everything in a calculated moderate amount. Having a balanced diet is what I would suggest. Having protein added in your meal, in whatever way, in a vegetarian diet, by paneer, tofu, eggs, or anything. Uh, you can always have iron-rich diet, because we are facing, and women are already having iron deficiency anemia. So iron-rich diet like beetroot, spinach, all those things combined with vitamin C helps better absorption. So oranges, lemon. Also good fat, if I have to say, it can be from ghee, consuming ghee on a moderate quantity on a daily basis, or adding some soaked almonds, walnuts, or some seeds, flax seeds, chia seeds. All these, a balanced diet is what I would suggest, rather than going for crash diets and affecting your health internally also.
What about you? Do you suggest any, you know, foods that people like? He suggested a few which is on a balanced level, but you know, like people say avocado is a superfood, or you know, any such food ingredients that you think?
Yeah, I think what I feel is, the food part, yes, but again, the kind of lifestyle we have now, you know, we are always eating on the go.
Yeah.
We skip our meals with the hectic work we have. We are on long caffeine hours while at work. So I think all of that definitely causes the deficiencies, and the overall, you know, the skin and hair is impacted for that.
When you speak about on the go, one of the biggest factors is stress, right? You're constantly in a stressful environment, you're overstimulated, working hours are erratic. Also, it's just, I think, a general phenomenon that's happening, which is so much to do with like hustle culture. But stress remains a uniform pattern. How does stress affect the hair?
Stress, so there are different kind of stress. If I have to speak about related to hair, just to give a brief about it. So hair has three phases. One is anagen, one is telogen, one is keratin. Anagen is the growth phase, where hair is approximately 2 to 7 years. It's in a growing phase. That's 85 to 90% of the hair on your scalp. Then there is the telogen phase, which is 10 to 15%. That's known as resting phase or a shedding phase. It sheds off and the new follicle comes out. And there's a catagen phase known as 1%. It's a transition phase from anagen to telogen. Now, what happens is a stress which is created in body. It can be because of medical illness. It can be because of some surgery or a recent incident which happened, which will shorten the anagen phase of your hair. That's the growing phase, and accelerate the telogen phase. It causes known as telogen effluvium. And what happens, it is seen after 2 to 3 months of the episode. So supposedly you fell sick in January and you start seeing hair fall in April. Maybe you'll not even be able to connect the dots that you had some incident in 3-4 months back, and now you suddenly start seeing excessive hair fall. At the same time, but this is if taken proper actions, if taken proper guidance by a medical professional, it can be controlled, and supportive therapies will help, and it recovers well. At the same time, chronic stress is something which disturbs your hormonal balances. It may aggravate, it may cause this anagen growing phase shortened into a permanent level, and cause premature thinning, miniaturization of hair follicles, and a kind of permanent damage. So that is because the chronic stress, your sleep cycle is disturbed, your cortisol levels are very high. All these affects the hair for sure in the long run also.
There's so much emphasis on sleep, right? I've had so many dermats here who have recommended just, you know, if you don't want to do anything else, just get your sleep cycle right? And that they specifically say when it comes to skin. But how does sleep also help for hair growth or hair maintenance, whichever way it goes?
So basically when you sleep, you're going in a phase of tissue repair and regrowth in the recovery phase. So if you're having a proper 6 to 7 hours of sleep, there's hormonal regulation happening, there is tissue regeneration, there's cellular repair happening. All of this is very important. So if everything is right, people come to us and they say ki I have proper nutrition, I have a good healthy lifestyle, I work out every day and everything, but at the end of the day we just ask if your sleep is disturbed. If that is it, that can be one of the major causes of thinning and loss for your hair, and and bad skin also.
Another repercussion of the lifestyle is certain vices, right? Like drinking, or even social drinking or smoking. There's a study that shows that men who smoke are 2.5 times more likely to lose more of their hair before 30. Let's take it one at a time. How does smoking impact your hair growth?
Smoking basically, it has multiple reasons why smoking affects. It affects everything in your body primarily. But if I say specifically for hair, smoking, it has nicotine causes vasoconstriction. So there's reduced blood supply, there's reduced oxidation and nutrient supply to your hair follicle. There is a lot of free radicals which is created because of the smoke, which causes a lot of oxidative stress again. And there's a DNA and follicular damage also because of the smoking. So for sure, smoking affects a lot. At the same time, when I'm mentioning about smoking, I'll say people have switched over to vaping, considering it as a safer option.
Yeah.
Ideally, it is not. Even liquids have nicotine. Again, the same kind of vasoconstriction, reduced blood supply, oxidative stress, all those. So either smoking or vaping, it's going to affect your hair cycle and create damage to your hair.
And drinking?
See, drinking will not have a direct effect on hair follicle, but yeah, when you're consuming alcohol on a very regular basis, a chronic alcoholic person will have nutrition depletion. There will be liver function, which is liver acts as a very good detoxifying organ in your body. And if the metabolism is disturbed, there will be a lot of hormonal irregularities, which will create a lot of damage to your hair follicle. There will also if you say alcohol has a diuretic action, it makes you feel dehydrated. So that will again cause your hair to look more dry, brittle and frizzy. So indirectly, a person who's drinking on a regular basis, all these factors, nutritional deficiencies and liver detoxification.
But like in moderation, it's fine. Like if you're socially drinking, it's
I do, so I'll not deny that.
Yeah, so it's totally fine. Okay. The burning question is, can this hair that is lost through various factors that we just spoke about, is it possible to get it back?
So there is nothing like hair loss. It is a phase of hair thinning and hair miniaturization which happens. We can surely control it, we can surely delay it, but once it is gone from a terminal thick follicle to a thin villous hair, we cannot reverse that back. We can surely control and delay it by changes in what we are happening at a certain stage.
Right. And what about new follicles? Is that possible to
New
develop?
follicles, we cannot develop new follicles. It's by a transplant, we redistribute the follicles.
Right. So what about things like, PRP or all of these different, again, treatments that are available? What are your thoughts on that?
So it has to come as a individual requirement, whether a patient, what phase of hair thinning or loss a male or a female patient is there. We have to evaluate whether there's nutritional deficiency, whether it's a telogen phase of hair loss, whether it is normal androgenetic alopecia or a female pattern baldness. A structured plan, what age it is, what are the requirements of a patient. Accordingly, we structure a plan, be it medical, be it therapies like PRPs, rollers, mesotherapy, all those factors, or a transplant. Depending completely, it's individual centric.
Right. So it's not like a 100% sure shot.
Nothing except for transplant, because that's a procedure. Rest, we are dependent on the treatment and how the body is going to respond.
Right. We slightly discussed PRP, but so many people don't even know what that is, what are the benefits, what exactly happens in the process. If you could just talk a little bit about that.
So PRP, basically, it's platelet-rich plasma. It's what we do in a PRP process is we take your own blood, withdraw around 8 to 10 ml, centrifuge it twice and separate your own body concentrated growth factors, which are re-injected in the scalp. So it is like giving support to your hair growth factors, giving nutrition to your scalp and hair, making it stronger. It doesn't directly affect the main cause of your hair thinning, which is what majorly male and female patients experience, that's male pattern or a female pattern baldness. It's just giving some support to your existing hair. It will help a lot in the accelerated phase of telogen effluvium. Where you've suddenly seen a shift from anagen to telogen phase. It will give a lot of support. A person who's recovering from those procedures, it will help. Like also in postmenopausal or postpartum female, we just need some additional support. That is how it will work.
When it comes to women, it's estimated that about 50% of women experience hair loss during pregnancy or postpartum. Is that true? And how can
so women specifically, except for the nutritional deficiencies, women face a lot of hair fall because of the hormonal imbalances. Be it PCOS, be it thyroid imbalances. be it postpartum or menopausal. So during pregnancy, the estrogen level of the body is very high to protect the baby also. And once she delivers, there's a reversal of hormonal changes happening, which causes a sudden loss of hair. Similarly, menopausal women, again the estrogen prolactin level falls down and the androgen level is raised, which is the main cause of the female pattern hair loss. So yeah, that changes do happen.
But do they get the hair back after?
Again, if we control it, proper timely intervention with the proper support, we can surely control that.
Okay. There are so many theories about oiling as well. And some people say oil overnight, some people say oil 20 minutes before, others say don't oil. What is your take on oiling?
So, oiling in India, it's not just a routine. It is a culture which is developed.
Yeah.
So, overnight oiling, using excessive oil overnight, just massaging very harshly, tying tight braids after oiling, all these will damage the hair follicles for sure. Your scalp has enough sebaceous secretion, enough oil secretion to take care of whatever moisturizing effect it is required. Even people who want to, there are certain benefits of cold pressed coconut, almond oil and everything. They have their natural benefits, but it has to be used half an hour, a couple of hours before washing, and that should be more than enough.
Okay. So overnight is not like the best thing.
Not at all. Overnight,
in India,
yeah.
somehow
Yeah.
everybody, it's a tradition, like he said.
Yeah.
It's not like a treatment. And nowadays, if you see on Instagram, the number of hair oils almost each day getting viral, people very quickly rush to try those with a hope also. And that's very important, I think, which we should tell the audience, that hair oil, like he said, has some nutritive value, or maybe some moisturizing properties, but what's majorly misunderstood, that it's going to treat your hair loss or it's going to reverse the baldness. So that certainly doesn't happen with the hair oil, especially the trending oils that you see nowadays.
Yeah.
People say, oh, it's going to grow into so much of length and inches will grow in few weeks. Obviously, biology doesn't work like that. And a lot of people also claim like a 30-day trial with the oil, and if it doesn't work, we'll refund your money back. But honestly, all these products, the way it is marketed, of course, people buy it also because India is such a population, such a massive population. Yeah. I think I feel even 1 out of 10 people, if they're going to buy it, lakhs of units are sold, and I think the brand makes great money out of it. But in the end, by the time the consumers realize that these hair oils are not helping in any kind of regrowth, I think they've already made that money and the brand is done. So I think we need to be a little more mindful on that. A more dermatological, science-backed up theory. You should ask questions, understand the science behind the product that you are using, and certainly regrowth. If somebody's thinking of that miracle to happen by somebody offering you that bottle of oil, I think that is something in India people lack. They really have that hope that even a chronic baldness that you've been seeing, the androgenic alopecia over years, and they're expecting like in 2 to 3 months of the use of that miracle bottle is going to reverse the baldness. But I think that has to be really worked on.
Yeah,
that's a very big
it's
misconception.
It's not a quick fix that you use this and it's just going to be amazing.
And it can't regrow also. It can't regrow.
Yeah. What about post-wash care? Some people say that don't tie the towel too tight, or there's heat protectors of all kinds. There are certain styling techniques that one says that is better than the other. Is there something like post-wash care?
For sure, as I mentioned, using a cold or a lukewarm water for washing, and post-wash, if you are using a towel, don't rub the scalp very harshly. Be gentle to your hair. Just dab the scalp with a towel or something. Don't use a fine tooth comb on a wet hair and trying to just push and just try to style it with it. Use a wide tooth comb. Surely these small things benefits, not to tie your hair too tight, which may end up causing traction alopecia by stretching it too harsh on your hair. So these minor things would help for sure.
Yeah. And heat protectors, do they work? Can one effectively protect their hair through styling?
So no, they cannot protect, but they would less damage the hair. That's what I would put it into. Instead of using hot hair blow drying very frequently, instead of that, use cold hair for drying your hair, or just let air dry it. And using a heat protecting serum would damage it to a lesser extent.
On the flip side, have there been any stories of natural remedies that have gone wrong? You know?
A
I
lot.
think several of them that even come to the clinic.
Yeah.
So of course we do respect the traditional ways of, you know, whatever you do, like home remedies.
Like a champy or a oil
Yeah,
massage. Yeah.
that's fine. But I think certain natural ingredients, you know, that people try. There's some viral reel and they want to try. A very recent one, in fact. I think one of the patients that come to our clinic was using a combination of garlic paste. I was using an onion oil and the lemon. I think there was something that they checked in the reels and they ended up using that. You have to be very mindful, right? How much of portion and what
Yeah.
exactly, and how is your scalp type? I think everything which is natural it need not always be effective and at the same time need not be safe.
Yeah.
Got severe burns, like chemical burns and severe inflammation, and I think they took almost 2 weeks to
2 to 3 weeks.
treat this condition.
Yeah.
So I think all these things can really go wrong if you don't really have evidence or a medical backup to what you're doing, and if you don't know your scalp type, and if you're using it excessive. I think how much portion you use, all of that also
Matters.
There was a very recent incident on Instagram. This was in Punjab. There were around 60 to 70 people who were hospitalized with eye symptoms, and when they, you know, dived into what exactly happened. So in Punjab, there was a hair camp that was happening, and they had provided some hair oils to them, promising that that is going to reverse the baldness. And they were instructed that you have to apply it on the scalp for a few hours and then wash it. So obviously, most of us then don't realize, and we blindly follow with the hope that, okay, this is going to do some miracle. They applied it, and when they washed off, slowly every person started coming to the hospital with the symptoms of eye inflammation, eye swelling, eye pain, to an extent that they had to then get hospitalized. And this had, I think, the Times of India as well as the Hindustan Times, it was like the top news. For almost a week, those ocular symptoms in the eyes were there, and then they had to be treated. So sometimes when you go for something termed as Ayurveda or natural, but if you don't have any evidence proof and you just blindly follow, that
It
can
can be.
really be very risky. I mean, you almost took a risk with your eyes.
You know, sometimes you see those baby hair that come after certain treatments. Can PRP contribute towards that?
So baby hair, mostly what people do is use minoxidil as a vasodilator. It improves your blood circulation. As I mentioned earlier, your thick hair follicle is known as a terminal follicle. It goes gradually it goes over a miniaturization process because of the hormonal blockages, and goes into a villous hair, which is known as baby hair, which is not visible to naked eye. So just by PRPs, minoxidil and everything, you may see mild growth, but it's not going to be sufficient, evident enough for a head full of hair. So it is just a temporary thing also till the time you take it. All these processes are just temporary. It is an ongoing process because your internal damage is still happening. It is just giving some support to sustain that damage.
Right. So at Assure, what is the vision behind true hair care and hair support that you guys are trying to create?
Immediately after I completed my postgrad, as any other doctor, I was working at a clinic, at a setup, where I was introduced to this world of hair restoration and hair transplant, and that felt a lot of meaningful to me. Kind of impact it was giving to the well-being and mental well-being of an individual also. Seen a lot of patients walking in low, and after a few months holding their head high and going out of the clinic. That is when I thought I would be doing, this is what I'll be doing all my life. On the flip side, there are still a lot of unethical practices across. This industry is not regulated at all. People there are unprofessional people doing these procedures and everything, which was not the kind of perspective I had. So that is where the seed of Assure was planted. That is when I decided that I'll have to do something on my own, where I am accountable for everything what we are doing at Assure. Personally, people feel hair transplant, majorly deal into hair transplant. Hair transplant is a very laborious job. It's a tedious, time-consuming, long hours. So people, and even the guideline says that doctors are not required to do it completely. It can be done by paramedical trained technicians under a doctor's supervision, which doesn't suit with what I practice. last 10 years and till today, I've been doing my procedures individually, start to end, 10 to 12 hours, whatever it is. For me, it is a kind of meditation. It is the most relaxing thing what I can do because it is 100% focused. You are calm, you are concentrated, and something this is what I'm very passionate about because I know what is the result it's going to get, how it's going to make the patient that happy. It is a mixture of science and art. So that is the reason I'm still passionate and I still keep doing it. In fact, we have a team of good number of doctors who are equally good, and they are also trained in the similar way. They also love doing their job, and that's a reason. That's a difference. Also, we would want to create it.
In fact, it's not only about hair. It's not just fixing hair. We see a lot of shift in the overall personality. Like
Of
I
course.
interact a lot with patients pre-surgery and post-surgery. So the entire surgical segment, of course, he handles, but the pre-counseling that happens, the way they walk in, at any age, it could be somebody who's a student or somebody in the middle-aged. I think hair is an emotional value that everybody holds on to, whether men or women at any age. And when we fix that, and when you see them come back after 6-8 months with that head full of hair, that density the hairline has created, the crown is filled up well, I think the overall body language, the energy with which they talk to you, everything literally shifts. So a lot of times I feel it's not just about the physical appearance, it's a lot deeper, because somebody who has been struggling for hair loss for several years, they've started living and accepting that, okay, this is how it is. But that little shift and transformation when they see, I think that was one of the turning points, because we used to be very excited every time the patient would come in after a follow-up, and we would see that result and how it impacted their life, the entire personal journey they would share with us. So I think that was one of the reasons why we also wanted to reach to more and more audience. And that's how, after Mumbai, then obviously several other locations also we started. We had a lot of doctors whom we trained, and we wanted a medical aesthetic care to reach as many people. And that's been one of the visions for sure, that we wanted to give like 100% service, and I think we enjoy that. Like he said, it's become like a passion. And in the initial days when we started doing those procedures, we saw the outcome. I think we realized we wanted to do more and more of this. So I think that's how then gradually it built it up.
Okay, so let's get into the weeds of hair transplant, everything that one would want to know, because there's so much out there in terms of information, benefits, are there side effects, etc. So let's walk through the entire process step by step.
Sure. So here, I'm going to take more time to explain everyone what is a transplant. So hair transplant, basically it's a redistribution procedure where it's a two-part process: extraction and implantation. Medically, it's categorized as FUE and FUT, and different names are given by different individuals. FUT is follicular unit transplant. I'll just explain the medical term. It's a strip technique. A strip of skin was removed from the back of your scalp and approximated with stitches. It's an old school technique we don't practice nowadays that much, because there was a scar which is aesthetically not acceptable, the chances of persistent headache, and the area is damaged, and all those factors. What we normally practice nowadays is FUE, that's follicular unit extraction. Going back to two-part process, one is extraction, implantation. In extraction, what we do is, this is known as the safe zone, the donor area of the scalp. We take out follicles one by one, randomly, maybe alternatively, extract the follicle with a motorized machine attached with a punch. So hypothetically, these are your hair follicle. There's a punch which is attached to a motor. It goes, surrounds the follicle, cuts the attachment of the follicle, and we extract those follicles. It's kept, and those follicles are then implanted in the area where we require to grow hair. That's known as implantation. This requires, both these processes are very important, because hypothetically we end up damaging or scarring the donor area. It becomes patchy. If the implantation is not happened at a proper angulation, if the depth of the follicle is not maintained, there will be a cobblestone appearance, something on the superficial of the skin. If the direction of the follicle is not proper, if you see a lot of gaps between the follicle, the density is not maintained, all these minor things are very important. That's the reason I always prefer a trained, qualified doctor to do the procedure rather than getting it done by someone who's just trained for a procedure, because it's not only the art, it is a science backed with the art. So every individual who's doing the procedure should understand how important the follicle, each and every follicle is. If hypothetically, if you're damaging one follicle while extracting or implanting, it's going to be a waste from your body. We cannot create that. So that's very important in the transplant procedure. A transplant procedure has to be designed as per the requirement of a patient. Some may require a 1 day, 2 day session, some may require more sessions, some may require a distributed session over a period of few months, because over harvesting from the donor area may make the donor area patchy. Not overdoing at one particular time, not adding so much stress to your body, limited anesthesia, the comfort of the patient as well as the doctor. Taking all those consideration, we have an approach where we design a procedure for a patient, be it a male or a female, as per their requirement, and go ahead with it.
I think very important to mention is why he was saying it will scar is because the follicle that you extract, that doesn't regrow back in the donor.
Ever. Once
So
it's
that
done.
is the biggest challenge, because like he said, if you over harvest or if you over extract, you can't undo those damages. So that is why, and like let's say we have a case where it's a large area of bonus.
Yeah.
Now the donor is very limited. Area to cover is very large. So sometimes what happens is you see a few transplants where they look very unnatural because only the front is covered, rest all is still patchy. They couldn't cover the whole scalp with the transplant. So what happens is when you're in spotlight, when your scalp is wet, the transplant looks pretty patchy.
Yeah.
And that's what it looks very unnatural.
Correct.
So why we divide this into multiple sessions, like he rightly said, which I talk a lot while I'm counseling the patients, because majorly when we consult the patient, the biggest challenge is to convince them to give us time. They all have come with the mindset that it'll be a single day surgery, because that's how the trend is. Transplants are done in 12 hours, 14 hours, like a single day procedure. How we're doing here at Assure, like for Dr. Abhishek and his whole team, we do it over 4 to 5 days. So when you split the sessions, what happens is you go for shorter sessions. So let's say you are coming to us for a 3-hour procedure. The pain is going to be less, the inflammation will be less, your comfort is better. Also your grafts will survive better. And surgeon efficiency and precision also is going to be optimal. And your body can also take it. So what we do is we do it over 4 to 5 days, each day 3 to 4 hours. And the good news is, post the procedure, you don't have to sit at home. A lot of people have that worry, the work will get affected, how would it look? You can do your at least basic daily activities. So the local anesthesia effect, once it goes, maybe 1 or 2 painkillers and antibiotics takes care of it. So overall, it's a quick recovery. It's a very safe procedure. And the good part is it's your own hair follicles, right? You're not putting any foreign body.
Right.
It's just the way you transfer, the skill of it, the precision of it, and most importantly, the aesthetic part.
Right.
So the angle placement, how are the follicles blending and merging? We explain that to the patient so that they have set the right expectations onto, what can they expect in terms of outcome for the procedure.
But what does it typically take in terms of pre? Like, is there a full need to shave all of the hair off? How do those things go?
So depending on the requirement again, there are certain people who are facing the cameras on a frequent basis. There are certain political people who would not want to reveal they are going for a transplant. And there are multiple techniques like non-shave technique, long hair transplants, partial trim techniques, where we camouflage or manipulate in a way that it's not visible to the outer world over a period of 7-10 days. That is also possible. And certain areas where we are forced to shave off completely because it's a huge area to be covered with a limited donor, then it is again completely individual.
Okay.
But the donor has to be trimmed, because without trimming this, you cannot harvest the follicle.
Right.
So trimming, like a zero trim at the backside, is mandatory. But
For men and women?
Yeah, for men. For women, we don't trim the front, of course. So for women, what we do is, because they have good length, we pick up the length. What they do is they trim underneath. They harvest the follicles, and with the top length, that can be camouflaged.
Right.
So in women, honestly, it's good because it's not so visible. You have the advantage of the length. So when we are actually counseling them, they have this worry because they've seen a lot of videos on YouTube where they've seen men getting a transplant done. So they have
they're fully shaved.
Yeah.
Even I've seen a lot of those videos.
So for females, we don't need to. In fact, even in the area where we are implanting, with the existing length, we use those micro implanters. So without damaging or causing any other collateral damage, we can very smoothly implant without having the need to trim at all.
Okay.
Just the posterior part has to be slightly trimmed, but again, that gets covered into the length.
Right.
So for women, I think aesthetically, it's not a big challenge.
It's a female
so
story who didn't tell it.
Oh yeah.
What is
Yeah,
this?
yeah. In fact, one of our patients, she was not allowed to get this aesthetic procedure done because the family background that she had, they had very, traditional thoughts that you use amla juice, you do this and that, but not very okay for a female to undergo a hair transplant. So she went through the whole process without informing at home. And imagine it was not detectable. So during those 3-4 days when the parents were away is when she planned the procedure, because of course you have certain dressing, bandage, which is visible for 2-3 days. So she planned it in such a way when there was nobody around. And after I think a week's time, what happens is tiny little follicles start to pop out. So what happened with the mother-in-law is she misunderstood, or rather she was happy with the fact that this is the oil that I gave you that's working.
Yeah.
Because she was away in that entire week while she was undergoing the procedure.
Understood. Yeah.
And the hair grows very gradually, right? It takes good 6-8 months to see the length and density.
For women or for men?
For men and women both. So transplanted hair, it's just a tiny hair that grows first. The mid-length comes over 3, 4, 5 months. 6 to 8 months is where you see fuller length. So it's a very gradual process. So she thought it's the oil or whatever therapy she's giving to her daughter-in-law that's working. But actually it was the 4-day procedure that we'd done for her. We'd filled up the entire female pattern, the balding areas. And those then showed the growth, and within 6-8 months it merges with your own hair.
And does it last forever?
If taken from the safe zone, that's, as I was mentioning, the backside of your hair follicles do not have those hormonal receptors. So the damage which is happening because of diet to testosterone will not happen that much. It will not go into that miniaturization. So it will stay for a longer period
Of time. Okay. And what is the typical density that you can see for men versus women once a transplant occurs?
If a healthy donor, themselves, if they have a healthy donor and a good quality follicles, you can expect almost matching your natural density.
Which was there prior to any damage?
Before a decade or two.
Oh, wow.
Yeah.
If the donor is healthy, we have the scope to give that kind of
The
density.
donor here is your own
donor.
Own hair.
Own hair.
Okay. Yeah,
So
same
you
as-
cannot use anyone else's hair. So that's the reason it is a very critical thing that not to damage the donor area. That is where our so we have a different vertical known as edit, which comes into picture because of
so a lot of cases where they've had a past history of a transplant already done elsewhere and it didn't work for them. It's like a revision surgery now. So we have a separate vertical, like Dr. Abhishek said. It's called Edit by Dr. Abhishek under the brand of Assure.
Okay.
So almost 3,000 to 4,000 complex cases we've dealt with in this segment where the patient had come to us. He already had undergone a transplant in the past. So they come with a very compromised donor, right?
Yeah.
Because certain part is already exhausted.
Yeah.
So with those limited hair follicles which are available, with utmost precision and of course with the right tools and technology, we help harvest more and then firstly repair the hairline, because you've often seen those patchy spars grow that you see. So first we have to obviously repair aesthetically and give that denser look in the front, and eventually then we go backwards. So a lot of these revision surgeries are now pretty common because, like he mentioned,
And it's gone wrong somewhere else.
Yeah, so that way.
What is the cost component? So a lot of people here would be very excited, okay, I'm going to go and do this. What should they be prepared for? Not only just for the actual procedure that happens over 3 to 5 days like you mentioned, but the post-care. And then we'll go into post-care as well.
So talking on the cost part, I think very important, firstly, even when we talk about the cost, we need to ask who's doing the procedure, because the whole cost depends on that. Like for instance, if we talk about our clinic, we have different segments of doctors, right? There are a few who've joined us 2 years ago. There are a few since 4 to 5 years. A few are working since 6 to 8 years. So based on their seniority, there would be different packages. But again,
Give me a ballpark.
So the price range would vary from like 1.5 lakh, and it also goes up to 15 lakhs based on your grade of baldness firstly, how much of time, effort and skill would be required in the procedure, and then of course who's doing the procedure.
And is it different for men and women, the cost, or not really?
Not really. Again, it depends on the extent of hair loss and how much hair follicles you need, and again, who's doing the procedure.
Is this a standard price? Like we're obviously discussing your clinic,
Yeah.
but across the board, is this what typical hair transplants
So
cost?
transplants also cost pretty lower sometimes. We do see so many advertisements where they give a 50% discount. They're going on as low as possible, but again, it's at a cost, right? Because you are compromising. This is where you're dealing with human body, right? Even though it's an aesthetic procedure, the safety comes first, and I
course.
think a qualified, like suppose you are a patient, and when you plan a procedure, you would definitely want a qualified dermatologist to personally execute. You wouldn't be okay with the doctor just supervising and it's the technical team or the
Yeah.
support staff who's doing most of the job mechanically. So I think cheaper options, yes, there are quite a few in India, but again, it's majorly where doctors are personally not doing the procedure. It's more led by the technicians, with the doctors just partially involving.
Also, I would mention is the entire cost part is become a commercialization and marketing gimmick. Anywhere across the globe you go, it's not only in India. I'm telling you about US, London, Dubai, Singapore. I've been to every place. It's people are charging as per number of follicles. Per follicle, 100 rupees. Per follicle, $10.
Like the follicle
hair
that they
follicle
put
they
onto.
implant.
Okay, all right.
It may vary from 1,000 to 10,000 follicles, whatever people are require into it. As a patient, you can never count those follicles. You will never understand if a doctor is saying that it's 1,000, you'll believe it's 1,000 if you're saying 10,000. So charging as per a number of follicle and you never being able to understand, doesn't make sense. And why they're charging that way is because finally they are done by paramedical staff. Here we just clearly demarcated that a person who's doing the procedure with the kind of experience that person is holding in the same field, and accordingly their seniority and their expertise is coming into picture. So we've differentiated the price range. So across it is 50,000 also, it is 50 lakhs also.
Okay. it can go
It can
either
go
direction.
ways,
Okay, so if I'm getting this correct, it can be anywhere between 3 to 5 days or
Yeah.
3 to 5 days.
depending on the requirement again.
Depending
it may
upon
be
the requirement.
a break after 3 to 5 days and again a 3 to 5 day session after a month or two.
Could be there,
Could
could
be
be
there.
needed. Okay, but you also do the long at a stretch 12-hour ones?
Never.
Never. Okay.
I'll not prefer doing it. I will not even. I've had patients traveling from the US. Even if it's required to travel second time after 6 months, I'm okay. I'll convince him to come back, but I would not want to risk patient at any cost.
Okay.
Because longer procedures has a lot of downside. One is the patient comfort. You lying in a position for 12 to 14 hours. You'll be loaded with a lot of anesthesia. Though medically safe, but then you'll have to keep on adding local anesthesia because the longevity of the anesthesia is not going to be there. So you keep adding. You are risking something. Doctors, if a doctor is doing, I don't see myself also being 100% attentive for 12 hours at a stretch. It has to be led by multiple team and different technicians. The graft survivability also, when you extract and keep it outside your body after 5-6 hours, it starts deteriorating. So at some point you are wasting 5%, 10% of your follicles. Considering all those facts, better to get a 3 to 4 hour procedure. It is more time consuming, patience is required, but it's something for life.
Okay. I think we missed a very important question. Does it hurt?
If I'm doing a 12-hour surgery, for sure it's going to be uncomfortable, it will be painful, it will be restless. 3 to 4 hours, you don't even realize that you are undergoing a
So
procedure.
overall, quite tolerable, and I think
Okay.
that's the commonest question every patient.
That's
when
what
we
I'm
are
saying. Yeah, like,
consulting,
is it
they
going to
ask,
hurt me?
How
Yeah.
painful is it?
Yeah.
But while you're under the local anesthesia, obviously you don't feel anything. You're conscious, alert, but that area is obviously numb. When the effects wears off, also because you had done this segment-wise. Like imagine I've traumatized your entire scalp versus I am only entering one small area today,
Yeah.
allowing that area to heal, and you are coming back day 2 when we enter another area and we do not re-penetrate the same skin. So it doesn't get as sensitive and painful. In fact, we have people in the age group of 50s and 60s, because obviously the threshold to pain will vary as per age, but they very comfortably take it. We have so many people having sugar, blood pressure, other medical conditions, but very safely and not with major discomfort. The procedure is pretty well managed.
Okay.
So pain, I think, is maybe on a scale of 0 to 10, you can expect 3, 3.5, which I think with the painkillers, it's pretty
tolerable.
Yeah.
Yeah. Okay. So we've understood duration, we've understood pain threshold, we've understood the density that you can expect, we've understood cost also. How many people typically opt for this? You've seen this through the board.
So I guess you'll be
I think
better.
when we are
placed to answer
consulting,
this.
honestly, once you give the right counseling and once you identify that yes, he is a candidate for transplant, sooner or later people would definitely want to do it, because once they come to the clinic, they know they are suffering and they do have a problem. They've recognized it's just that they are looking for someone whom they can trust, and the procedure, once the clarity comes in while the consultation happens, I think more or less sooner or later everybody opts for the transplant. Some may go immediately for it based on their professional or personal requirements, but within 6 to 8 months, I think they are part of research and they do take that mindful decision that yes, because that's a permanent solution, right?
Yeah.
All the therapies, oils, PRPs, whatever you try, hair is not going to regrow apart from anything else but transplant. So after trying several therapies also, I think once
They
they
come back
understand
to this.
transplant is something that is required, sooner or later they very much go for it.
Okay. What about accessibility of these treatments, right? Like, where does one go to avail these services? Is it like really difficult to find? Talk to me about accessibility, especially because it is considered a luxury space, so to speak.
Right. So I think for the longest time, all the dermatology treatments and aesthetic treatments were always considered something which only a celebrity or the elite would do. And we've really worked hard from the very initial days of our career, where we are trying to make this reach to a larger population, right? Because I think losing hair, or if it's a skin or acne or a pigmentation, it's not a luxury issue. It's something which is very real, very emotional, and something which really does affect your confidence. So we've also realized as we started traveling domestically, a lot of locations, to mention a few, when I speak about one of my travels in the year 2016, I had gone to Raipur with a team of doctors in Chhattisgarh. We were invited by one of the premium salons there. We were very surprised to know that even for basic hair treatments, they would travel to Hyderabad, Delhi, Mumbai. So there was a lot of demand, but there was a lot of gap in the market. There were no enough medical aesthetic care treatments or clinics available. And a lot of other places like Indore, Nagpur, Lucknow, that's how we realized that, when we traveled, that if we can train our doctors in Mumbai, and then if we place them at different locations, this way we'll be able to have the modern dermatology services, hair restoration services to much more locations and reach to more people who are in need.
Yeah.
So I think that's where we've really worked hard to make it as accessible as possible to most locations with the right ethical, advanced and correct treatments.
Yeah, because what you said is right. It's no longer just considered a celebrity's domain.
Yeah.
Like, everybody wants to look good. Everybody wants to look a certain way. You want to indulge in, what's the latest good thing for you. So it's I totally see where you're talking about. Tell me about one particular case that you still remember, and you're like, okay, that person
Multiple
is really
stories
happy.
Priyanka can tell. She had encountered it.
So many of them. But yeah, a very recent interaction, something I can share with. I had a patient, he was in his mid 40s, right? In fact, when I was sitting in the cabin and he entered, usually I see that the body language or the confidence is a little lesser, but with him that wasn't the case. He was super confident, professionally doing very well, married, had 2 wonderful kids. So I wondered, that what must have triggered him to, suddenly after so many years think of this procedure. So I was waiting to hear from him. So he happened to tell me that, he had returned from his school reunion.
Yeah.
He happens to meet his friends almost after 20 years, okay, because he's in mid 40s now. So it's almost 20 years later they were meeting. He actually told me, Karishma, that in school he was very popular for his hair. He's like, mere baal almost, they were like Shah Rukh Khan. So he's like, that's the last image my schoolmates had about me. So he's like, when they saw me, because obviously he had majorly lost most of his hair, he's like, with the busy schedules, your life, your marriage, your kids that you're handling, you don't really prioritize yourself so much. And he's like, I was living with it. But I think that day was a very triggering day. Not that obviously at that age nobody's going to bully you or mock at you, but he's like, the way people were looking at me with such a surprise. He's like, when I went back home and when I saw in the mirror, I was wondering that why did I let those hair, lose over these years, and I really want to fix that back. So sometimes it's a very small trigger. he's like, I really wanted to reconnect back with my older version, what people still have in their mind for me, the guy with
The big hair.
maximum
Yeah.
hair on the scalp. And that's when he took a decision, no, that I really want to go with the
And
procedure.
did he get that hair back?
Yeah, of course. So a year ago when we did his procedure, and within 6-8 months, the hair was restored. Literally, you won't believe, when I see him coming back for follow-ups, the entire energy, the vibe. In fact, we have a mirror right inside the clinic when you enter. The way he, kind of grooms his hair
That's
and
so
sets
sweet.
it.
Yeah.
So I think hair is just a small, change, but that
I don't
brings
think
in
it's a
bigger-
small change. I love hair. So I totally understand. I don't love hair like that, but I love taking care
everyone
of
started
it. And
now taking the. In fact, once we just recollected is very close to me was that father and daughter one.
Oh yeah.
You
That
should
one is
elaborate. That's the very close story to me.
okay.
Sure, that's a special one. So, very
That's one.
sweet, innocent story. There was a patient who came in with his daughter and one sketchbook. So, he'd already got a transplant done from us a year ago. And he happened to call me that I would come and meet. I thought it could be a basic follow up. But to my surprise, he got his daughter and a sketchbook. And I said, what is this all about? He said, last week we were having dinner. And my daughter has this habit. She sketches a family portrait always over this last 1 or 2 years. So she'll, sketch her mom, she'll sketch the elder brother, she'll sketch herself, and when she'll sketch the father, she'll always draw him like bald, right?
Yeah.
So he's like, obviously, because she was too little, he had never discussed his transplant because she would not obviously medically understand. But what was surprising to him is so closely she was observing him. Because when the relatives came in, she actually went to the room, she got her old sketchbook out, she went back onto every page, and wherever she's been drawing him bald, she took her crayons and she started sketching hair on
How
it.
sweet. Yeah, that's really
First
cute.
tiny little hair, then slightly grown hair, and then fully grown hair.
Yeah.
So he's like, oh my God, I didn't even realize that my daughter was observing so much of my
Yeah.
hair transformation.
That's so sweet.
So yeah, these are small things, but bringing so much joy and
yeah.
happiness. So
When you speak about follow-up, what is the post-care that happens for a transplant typically?
So if it's a complete transplant, I believe nothing major is required. I personally have this approach that I normally don't give medicines post-transplant.
Like
Maybe
oral medication.
oral medications may be against the medical advice, what is there as per literature. But I've been observing my patients closely for over 10-12 years. I've not seen a variation of more than 5-10% also without medicines. The reason behind is theoretically it's taken from the safe zone, it doesn't get damaged by the DHT, and the medicines available are again DHT blockers. So not going to the science, but it is not going to get affected if taken from the safe zone. On the other side, at a young age person who's going for a transplant, these medicines have to be taken all your life.
What's a young age? Like a typical young age in your consideration?
Now what I see, people in early 20s also have come for a full head transplant.
Really? Okay.
Yeah. Obliging that patient at 20-25 to take a medicine for next 30-40 years, which I know is not possible. I'm adding some kind of side effect. It's medical medicine. The side effects are very minimal. It's FDA approved drug. I agree to all of that. But people now are so aware and they read everything on Google. They start Googling about things, and the first negative thing you see is in your mind. They are always hypochondriac about it, that I am also having these symptoms. One, over a period of 3 months, 6 months, a year, they will discontinue. It worsens more. So better in a transplant where it's not occurred, where I feel that there's just a front area which I've done very young. I don't want him to go for another transplant for some years, and we can save that with medicines, and we'll explain that to the patient and make sure that he's taking it regularly with the medical guidance, having a proper follow-up and everything. So again, varies as per patient whether medicines are required or not. Mostly I would not prefer, but yeah.
You said another transplant.
So supposedly consider someone who's bald from the front or just bald from the crown. So that area is transplanted, that is from a safe zone, it will stay. But other area where a person can experience a male pattern or a female pattern,
non-transplant
area, that is still under the hormonal stress which happens, which causes the meningitis. So that can happen. In other language I have to say, I'm operating on right knee, that is fixed, but left knee can get damaged.
Understand. Okay. What about things like haircuts, hair color for girls? I mean, men also do it, but that's totally fine after the transplant?
Haircuts, yeah, that's completely okay.
Okay. I mean,
That's
I
like
mean,
a
it says,
natural
yeah.
external chemical damage. What is happening to otherwise also will happen. But yeah, as much as you can avoid, that's a good thing for a color. Haircut is natural. It grows naturally. You can shave off your head also. It will grow naturally.
Okay, we'll go to the next segment. It's hair treatments by concern. So you have to just address what it is and try to shed some light in the right direction of what's there out there. What's the difference between hair fall and hair thinning, and how should they be treated differently?
So, just to make the basics very simple, that hair fall is a normal process. Every individual will experience a hair fall of 50 to 100 hair fall in a day. That's pretty normal with every individual. It goes in a cycle of growing, shedding, recovering, everything. Hair thinning is hair miniaturization, which is happening majorly because of hormonal imbalances like dihydrotestosterone. It attaches to the follicle, causes miniaturization of the hair follicle, which leads to eventually baldness. So, if you are experiencing more than 100, 150 fall a day, you should visit a doctor, get yourself evaluated instead of trying any kind of viral trends, something on social media, something. Evaluate by a doctor, it would fix it better way.
Okay. How do you treat a receding hairline or a balding crown?
Area where it is already receded, as I mentioned earlier, a follicle has gone from a thick follicle to a villous hair. It will require a transplant. If we started seeing thinning, we want to delay the process. Maybe medicine in combination with PRPs or other therapies would work.
Okay. What are the most effective treatments for dandruff and maintaining a healthy scalp?
Maintaining a healthy scalp first is to understand your scalp quality. What kind of scalp, what kind of skin it is, whether it's oily, whether it's dry, what kind of shampoo you should be using it. Like other measures, not using too hot water, not rubbing your scalp towel, just dabbing it and drying it, not using fine tooth comb on wet hair, not using too much of blow drying hot hair, styling machines and everything. Just avoid all those as much as possible.
Yeah. It's the wrong person this information has come to.
Because externally you are
single
ending
day.
up damaging it.
Yeah.
Whatever you do, you're damaging with a chemical or a machine.
What is frizz, and what's the best way to manage frizzy hair, especially in like humid climates like Bombay?
So basically, see, a lot of that people have those kind of dry scalp and frizzy brittle hair. Most important thing is people need to understand the importance of staying hydrated. That is always underrated, because when you feel when you are dehydrated because of any reason, the most vital organs in your body, the body will divert those hydration to those vital organs instead of hair, and that is where it gets affected. I'll not say staying hydrated will improve hair fall or improve the thing, but it will keep the quality of hair better. So staying hydrated, one thing. Not using too much chemicals. Using a hydrating shampoo. You can use some leave-on serums or some oils, condition your hair using some hair mask or something. Not to use a fine comb on a wet hair and just trying to detangle it. Immediately after drying it, you can just use it from the border split ends, clearing it, and not giving at least some time even immediately after wash would solve most of the problems, rather than just keeping it wet and just going around and then trying to do it after some hours.
For those who color their hair often, what is often for hair coloring, and what should be the best practice? I know best practice would be don't color it, but after that.
See, I wouldn't suggest only coloring, but yeah, when you have left with no option, you have to use it. So the more minimal you can use it, it's the best, what I can suggest.
Like once in a few years, once in a year.
What kind of coloring? People who are graying and who don't want to do that, who are prematurely graying and everything, they would want to use it more frequently. Can't help it. But just for styling purpose, more than coloring, what people started doing is coloring, then bleaching, trying to change the color as per the trend.
Yeah.
So that damages your hair more. Avoid doing that, and it's much more safer.
Okay. The next section that we have is hypo hack, which is trending beauty hacks. So, is it good or is it not good? Let's just discuss that. Onion juice and amla for hair growth.
So it's a hype.
Okay.
Though onion juice, amla contains a lot of vitamin C. Externally, onion juice will have a lot of anti-inflammatory, antioxidant, a lot of sulfur, which may strengthen the hair, reduce the inflammation, improves blood circulation. But as she mentioned earlier, using it not properly, using it too frequently, maybe can cause an allergic reaction, can cause an chemical burn kind of reaction on the scalp. And unless you are keeping yourself nutrition internally, these things externally won't make such a difference.
Silk pillowcases for less hair breakage.
It's actually a good hack, I'll suggest, because it causes less friction when you're sleeping over. So yeah, it would cause less breakage, specifically in frizzy and dry brittle hair.
Okay. Washing hair in cold water to avoid frizz.
It's better to use a cold water.
Okay. Rice water rinse for hair strengthening.
Again, some kind of hack, because the starch water which is there, it contains a lot of vitamins, minerals, inositol, all these helps in strengthening the hair bonds, but using in moderate quantity once in a while is good.
Castor oil for thicker eyebrows and lashes.
Unnecessary hype.
Yeah.
I wouldn't suggest, because that will never help you in more thicker eyebrows or eyelash. In fact, this may lead to an eye inflammation.
Okay. Hair Botox for hair loss.
Hair Botox, so first is it's a misnomer. It is Botox. What we used to do is a botulinum toxin. We do it for skin to take care of the fine lines and wrinkles, which relaxes your muscle. This is just a similar terminology used to smoothen your hair, to make it look more shiner, and externally it's chemical driven. Doesn't take care of any kind of hair fall or stops hair fall.
Okay. Overnight hair oiling for healthy hair.
No, complete no.
Okay. Okay. We'll get to a few actionable practices that people can really take away from this episode. There's so much information about multi-step hair routines that one can do. But what do you think are 3 non-negotiables that people can do on an everyday basis to maintain the quality of their hair?
Primarily, have a proper nutrition. Like a balanced meal with including proteins, ions, vitamins, and good fats. Sleep well. Avoid excess of chemical damage to your hair, and maintain a good scalp hygiene.
Okay. Let's get down to some actionable steps that people can take. The number one thing that people even struggle with, and it's estimated that about 40% of people are not even able to identify what their hair type is. Like, is it dry? Do they have oily hair? What is one simple way that they can figure this out? What kind of hair do they have?
So it's very simple. There are multiple types, but majorly it is oily, or majorly people feel it's dry. So what I'll suggest, a simple step is just wash your hair with a mild shampoo. Let it air dry for 24 hours. After 24 hours, if you feel there is oily or greasiness on the scalp, then for sure you have an oily scalp. After that, if you feel there is itchiness, tightness, or dryness, then there's a dry scalp. There's a possibility then some people may experience oiliness, greasiness in the crown and dryness in the front, then it's a mixed scalp. Similar with the hair also. If there is hair, it's oily, greasy, and it falls flat, it has to be an oily scalp, and with dry and brittle and frizzy hair, it will be a dry hair.
So wait for 24 hours.
Just after a mild shampoo, wait for 24 hours and get an idea what is the scalp kind.
So you said mild shampoo. Are there any basic practices that people get wrong, even while doing something as basic as hair wash? And is there a right way to do it?
So hair wash, I'll say again, it depends on individual, what it is, how an individual is experiencing, what kind of scalp it is, what kind of climatic conditions and environmental conditions, what kind of water they are using. Every factor is important. If I have to say, people who are having an oily and greasy scalp, washing every alternate day is good enough. They should be doing that, because otherwise it will clog the follicles. There will be a lot of greasiness and oiliness, and that will attract more dust particles. If they have dry, itchy, and tight scalp, then washing once in 3 days is good enough. And they should be doing it with more hydrating shampoos. People who are having, in fact, other climatic conditions also, like people who stay in humid climate like Mumbai, they'll always want some kind of clarifying shampoos. People who are staying in a dry north area, so they would require something which is more hydrating. Pollution is also a very underrated enemy for hair. So people in metro cities like Mumbai, Delhi, where the pollution is very high, would suggest something which has more antioxidant to the shampoo and protect the hair as much as possible. So depending on the climate, depending on the scalp type and everything, they should be suggested for what kind of wash, what's the frequency, and what's the shampoo.
What about water temperature? You know, there's a saying that don't use hot water on your skin or on your hair, and it causes more damage. Is that true? Does temperature play a factor?
Yes, using extreme hot water would strip down a layer of your hair. So avoid using extreme hot water. Using lukewarm water or cold water will give you, it's a temporary hat to at least help you in setting the hair right and not damaging the hair follicle. So using a cold or a lukewarm water is better than using an extreme hot water.
So given what you've accomplished over the past decade, what's the larger vision for Assure clinics now?
So definitely we want to upgrade, and what we've been already doing, we want to get better and better. But from the medical innovation point of view, I'm sure Dr. Abhishek and the team are working on it. But if you ask me, my vision is more towards the operational side, because even if you have the best of techniques and innovations, but if it's not reaching to enough population, it doesn't really work. So I think I have this vision that, we want to form a dream team where we have the set of doctors where they're very like-minded, at the same time also kind-hearted, because what I have realized over these years, when you do business, right, but when it's into a medical field, you're actually dealing with human body. You're not dealing with a product, or you're not dealing with numbers. So it has a very different sense of responsibility as well. So we want more standardized protocols so that across all centers, we have that quality. We have those skillful and qualified doctors. So on a longer vision, if you ask me, we want to be one of the most trustworthy place where if somebody thinks of hair and a hair concern, they know that they will get the honest, approach, the right advanced treatments, and we will obviously, they'll rely on you, they recommend you, not obviously because you're trending, but because you've been very impactful in their journey. And I think the vision is to have the foundation that we had for sure. We started with the intent that we want to be very patient-centric, give our 100% of whatever we can to our patients. So obviously that similar team who doesn't look at it as a job, but definitely has a similar vision the way we do, is something which I really, aiming at. Yeah.
Anything you'd like to add?
For me, it is trying to get in sync with the trending world, getting AI incorporated. We are trying to incorporate something to design a hairline, with the most critical part about a transplant. Developing certain softwares which will allow a patient to decide what kind of hairline, what kind of hair follicles to be placed, the angle, the direction. It will be printed and placed on the scalp of the patient so that we can eliminate the human error what is having. Next thing is we are also working and trying to be in sync with the researches happening across the globe, where as I told you, hair transplant, the most critical part is the restricted donor. It's someone who's depleted with the donor area, the transplant is not possible. And already damaged donor area, it becomes very difficult. So there are studies and the researches on which is working on cloning the donor follicles, which is yet not FDA approved, looking for a long-term thing. So yeah, we are working on that too. End of the day, same thought process, trying to create a team, trained qualified doctors and trying to regulate the guidelines, which is very highly unregulated in this field. Because for doctors, there is no institute in India or globally where you train a doctor for a transplant, and unless you are trained hands-on, you will not get that practice and you will not be able to practice. So we are trying to open a training institute for the doctors who can just serve across.
Fantastic. All the best with that, and I'm sure it's going to happen for you guys. And the AI stuff sounds very cool, to be able to design it.
Right.
Yeah. Thank you.
Thank you so much.
Thank you so much.
Okay, that brings us to the end of the episode. Thank you so much. I think I've got all my questions answered, and hopefully people use this as a measure of making more informed decisions and not following things like, castor oil on eyebrows. But thank you so much. It's been so lovely to have you, and we hope to see you soon.
Thank you.
Thank you so much.
Thank you so much.
Thank you.
We hope this episode added value to your lives. Join the Realign movement. Like, share, and subscribe to our channel, and we'll see you in the next one.